So we're back with another immunology question. I know upon first glance this question looks kind of easy, but believe it or not, you get tested on these kind of things on step 1, and these are free marks. So if you don't know how to answer this, consider reviewing your immunology. So let's start. We have a 24-year-old woman, presents with fatigue and a smooth, shiny tongue. Lab shows macrocytic anemia with an MCV of 108. Which antibody is most likely present? So this is a pretty surface level question. All you really need to know is which autoantibodies go with which disease. So let's start with A, anti-dsDNA. This is specific for systemic lupus erythematosus. Expect in this vignette to have a malar rash, photosensitivity, proteinuria, and low complement levels. You'll also see things like arthritis or renal issues like high creatinine, low GFR, and stuff like that. Therefore, A is not the appropriate answer here. Now moving on to B, anti-mitochondrial antibodies. This is seen in primary biliary cholangitis. This is pathognomonic for that. You'll see a middle-aged woman with pruritus, fatigue, elevated alkaline phosphatase. This is due to the autoimmune destruction of the intrahepatic bile ducts. Therefore, B is also incorrect because we have none of those symptoms in this vignette. Now, as for C, anti-intrinsic factor. This is the correct answer. This is due to pernicious anemia, which is autoimmune destruction of gastric parietal cells. We lose intrinsic factor when we have destruction of the gastric parietal cells. Therefore, we have decreased vitamin B12 absorption. This leads to a macrocytic anemia, hypersegmented neutrophils, glossitis, and possibly some neurological symptoms like paresthesias, ataxia from the dorsal column involvement, and much more. Therefore, this is your correct answer. You have an elevated MCV, which is 108 above 100, which is the normal above the normal range. And shiny tongue is also a symptom seen with pernicious anemia. Therefore, C is the correct answer. Last but not least, we have D, anti-smooth muscle antibody. This is found in autoimmune hepatitis. This presents with an elevated ALT and AST, jaundice, and a positive ANA sometimes. We don't see any of these symptoms or lab values in this vignette. The most appropriate answer here is C. D is wrong. Thank you so much for watching, and if you enjoyed this video, please follow our Instagram, our TikTok, and our YouTube. Thanks so much.